Hello friends, I'm happy to see you once again. In today's presentation, we are going to go through possible abuse, which is one of the professional values topics. And so if you are seeing me for the first time, stay tuned as we go through it together. Welcome to my channel, friends, Nurses Toolkit. We educate nurses, prospective nurses, and the general public. My name is Prosper. I'm a registered nurse in the UK and in Ghana. Thank you for supporting this channel. So in possible abuse, the scenario will be such that there's a patient under your care, and you might have heard or seen something that indicates that a person possibly might be undergoing an abuse. And so as a nurse, when you see something like this, you don't need to keep quiet. You need to take action. And so today we are going to see what you need to do, what action you need to take in such situations. And so as we all know, in professional value stations, we have 15 topics. You don't know which one you are going to get. And so you just have to be prepared in all 15. And in writing them, you make sure you write about 5 points, not less than 5 points. And it should be in the form of bullet points. It should not be in the form of essay. It should be in the form of bullet points. And so friends, let's go through. Number one, I will escalate concern without patient's consent. So in most cases, for most abuses, the victim may not want you to escalate or discuss it for others to know. But as a professional, if you are able to know that there is an abuse or you are suspecting an abuse, you don't necessarily have to get the patient or the victim consenting to it before you escalate. In as much as you are suspecting it, make sure you escalate. Number two, I will communicate with compassion and empathy in a language appropriate to my patient. So for most victims of abuse, sometimes they may be children or people who are vulnerable in society. And sometimes it is always difficult you trying to let them understand the action that you want to take, for fear that maybe they might lose some privileges. And so as a nurse, you have to be compassionate, and then you have to also speak to them in a language or at their level so that they'll be able to appreciate the action that you are going to take. Number three, I will act without delay as there is risk to patient safety, and I will raise concern at the first reasonable opportunity. For most abuses, in as much as you suspect, you don't have to delay. The reason being that the more you delay, the more the abuser will continue to inflict pain on the victim. And so if you suspect an abuse as a nurse, you don't have to wait. You just have to raise concern as early as possible. Number four, I will raise concern with management, or I will raise concern with my immediate manager or with local authority. In other words, you have to make sure you raise concern or you raise a safeguarding as early as possible. Each organization has its way of going about safeguarding. So you have to know the policies regarding a safeguarding in your organization. And when you suspect any form of abuse, you have to make sure you raise a safeguarding. Number five, we acknowledging, or I will uphold to the code. And so friends, these are the points that we are expected to write. They are just be brief and as simple as you can, and I know you'll make it in one sitting. It is my prayer and hope that this presentation will help those who are writing their OSCE. I will entreat you to like, to share, and to subscribe. Thank you for your support.